So today, my mama is going to tell you a little bit about this surgery that I had done.
Okay, so as you know, Tyler was born with spina bifida, which means he doesn't have very much fillings from his waist down. He had what was called a MACE surgery, M-A-C-E, which stands for Malone Antegrade Contingency Enema. And it just was a coincidence that it is named after him, but it was not actually named after him. Someone by that name was, I guess, the one who invented it. So if you have spina bifida or if you have problems, what it does is, let me explain a little bit about why he had to have the procedure. Because he does not have any control over his bowel movements because he doesn't have any fillings down there. So we have to catheterize him every 3 hours for the urine. But he still had to wear the diapers because we had no control over the bowels. So this surgery was to help get him to have a contingency with his bowels, so therefore he does not have to wear diapers anymore. As you see, he now has big boy underwear on. And let me explain a little bit about what the doctor is going to do if you decide to have this surgery. It is a life-changing surgery, and I would highly recommend it. He's only had it in for 2 weeks now. Well, tomorrow would be the 2 weeks, and it has already helped a lot. The doctor is going to take 2 small incisions right there and one right there on the side of his belly. Can you leave right there? They're going to cut right there and right there, and they're going to just put a little camera inside there, and everything's going to be done robotically. It took 2.5 hours for the surgery because it was done robotically. The doctor said it took a little longer. And they put an incision usually right in the belly button. Now this tube will come out Thursday. The tube has to stay in for at least 2 hours. So what I do is 2 weeks. I'm sorry. Thank you, Tyler. At least 2 weeks the tube has to stay in. Then every night I put him on the toilet. I remove this little thing right here. I fill this thing right here. I fill up a thing of water, and I put about 6 syringes filled with water, warm water, and I put it right inside, right there where that white thing is, the white plug. You take that white plug out, and you just insert this tube right here, this syringe, and you do 6 of them of warm water. And usually by the second syringe, he's usually going. You sometimes have to sit for about 30 minutes, maybe 45 minutes till you get it all out. The first couple of days can be a little messy, but so far Tyler has gone a week without having an accident. So that is pretty good. If you have this condition, you do have these problems, I would very highly recommend you talking to your doctor about having this surgery done, especially if you don't want to wear diapers to school, which I know a lot of you don't want to do that. So Tyler, how do you feel about the surgery? Are you glad you had the surgery?
A little bit, yeah. Here's a little tip: when you insert the syringes, when you take this out, clamp this, because
right, you do have to clamp that because water will come out. Yes, you do have to have a towel up underneath you, and then one on the floor to keep the water. But it's actually all in all good. He only hurt for about 2 or 3 days. So Tyler, how do you feel? How was your pain level, you think?
The very first day, I will say it did hurt a pretty hurtful bit.
It was pretty bad in the beginning because of course he just had surgery.
And then around 7:30, 8 o'clock, she led me down to cath me, because, I was once not moving, I have to get cath. And all of a sudden, this gunshot just went in my stomach, it felt like. It just felt so bad. And then Thursday, we got to go home, and
yeah, you only had to stay in the hospital 1 night, so that was good, huh?
Yeah, the pain went away.
Yeah, the pain went away. He only had his medicine, I think, 1 day while you were at home. So in other words, you had 2 days pretty much of pain, maybe 2.5 days that you were in pain, and the rest were okay. So, I mean, you know, you are going to have pain. You did have major surgery, so there is going to be some pain involved in the surgery. But all in all, it is well worth having.
Yes, and when you first get the surgery done, you will not poop for like a day. Maybe you'll poop.
Well, I don't know. I think it depends on the person. I've had a friend of mine who had this surgery. Her daughter had the surgery, and she did go to have a bowel movement that night. So it did take Tyler about 3 days before he was able to go, maybe 4 days before he was able to go.
And then when I went, I could not stop.
Yeah.
But then I got it under control.
Yes, now he's got it under control. But if you do have any type of paralyzation from your waist down, and you do have this problem where you have to wear diapers because of that, there is something you can do about it. Talk to your doctor about having it done. It is called MACE, M-A-C-E. So keep that in mind. Talk to your doctor about it, and hopefully this will help you just like it helped Tyler. So I hope this video did help you some. So thank you. Please subscribe to Tyler's channel, and we will continue to put videos out of his condition and some of the things that we think you may be interested in knowing.
So please like the video, subscribe. Bye.